that has to be managed by government. And we need more government. We need universal payment, universal insurance, or government-run systems. Because the system now is just wasting money, it's fraught with paperwork, and some people are left behind. All of which are kind of true. But this is why I wrote a myth book, because all these first thoughts, or many of them, turn out to be myths. Market competition does everything better. I'll give any of you $1,000 if you can name one thing that the government can do more efficiently than the private sector. And wasting money doesn't count. I'm sure if the private sector wanted to do that, it could do it more efficiently. Over the new year, I happened to be staying in a resort in the Caribbean, and my neighbor right next door, staying at Bob Johnson's house, turned out to be somebody important, I could tell, because suddenly all the Secret Service people were out there sniffing around. And then I learned it was Bill and Hillary were staying in the Johnson mansion next door. And I was fortunate enough to have a nice lunch with them, and I talked to Hillary at length about government health care, and she explained that the VA was a shining example of success after her husband had fixed it up during his term. Now this turned out to be before the Walter Reed scandal happened. And I was negligent in that I should have known, but didn't realize at the time that the VA is better since the Clinton administration reformed it. But when you start very low, it's possible for a bureaucracy to make it a little better. But what it doesn't have, and what no government monopoly ever has, is real innovation. And that's what really makes our lives better, and that's what really would help someone in the hospital. And in the case of the VA, it turns out that they will only approve for vets drugs, about 20% of the drugs that Medicare approves. So you don't get the newest, perhaps best stuff. It isn't always the best. In a free market, sometimes the wealthier people who try things first are the suckers. They buy things like 8-track stereos. But this openness in the market is a process that benefits everybody. Eventually the price comes down and every kid for $10 can have a Walkman radio. This would work for healthcare if we would let market competition work. But we don't think in those terms in Washington. We think about how are we going to solve a problem. We should stop taking for granted the miracles that capitalism solves all the time. And the idea that you can go, take a piece of plastic, go to a foreign country, stick it in a wall, and cash will come out. And you can give that piece of plastic to a total stranger who doesn't even speak your language, and he'll rent you a car for a week. And when we get home, Visa or MasterCard will have the accounting of a penny. But the government can't even count the votes correctly in Florida or Ohio. And yet government's going to make healthcare better? It isn't. So this is what I now focus on in my reporting. This is what I've learned over years of reporting, that government doesn't have the answers, and in fact, big government is part of the problem. And it gives me a slightly new point of view. I always had a point of view in my reporting. As a consumer reporter, I would take a position. We would do research, and we would say, this company's doing a bad thing. Alka-Seltzer is not a good product to take for an upset stomach. It's got aspirin in it, makes your stomach bleed, say 20 gastroenterologists. Now I'm doing the same thing, but I'm criticizing regulation, and suddenly my colleagues say I'm not objective anymore. And as Rebecca said, I've stopped winning awards. I don't care about the awards, but I do care that the people who give out the awards and the mainstream media profess to be wise and objective and neutral about these things, when in fact they are totally hostile toward capitalism. I'm not so sure why people in law and the media are. Maybe it's the people who are critical thinkers and get some economics. They go into business or science and they go mind their own business, and the people who want to run other people's lives have to go into law and journalism. I don't know, but my reception soon changed a great deal, and someone came up to me in New York and said, "Are you John Stossel?" "Yes." "I hope you die soon."